Hey Janet, I'm
Hello.
Tanya. Nice to meet
Nice
you.
to meet you.
Alrighty, so I'll be going over the paperwork that you just filled out. I did get to look at it beforehand, and I see that you're having some issues with your neck, but also headaches. Okay, and then I see where you were saying that they go up into the top of your head.
Yes.
Do you feel it like right in behind your eyes, at your temples, or?
I would say right here on the sides, like on
Okay.
the sides, right here.
And when did you first notice your headaches?
I would say probably maybe like 3 months ago.
Ooh, that is a long time to
Yeah,
get
that is a long
headaches.
time. It doesn't let me sleep at night.
Okay. And what usually tends to bring them on? Do you have them all the time? Do they come and go?
I would say I usually have them like maybe twice a week, 2 to 3 times a week.
Okay. Okay. That's still a lot.
Yeah.
And then are you taking anything for it?
Yeah, right now I just take Advil. I mean, it helps a little bit, but I mean, they always come back at night.
Yeah. Okay. Well, I hate that for you. I'm sorry. We see a lot of people coming in for headaches. Now, what we want to see is what is causing your headaches. So, it's not fun to have them at least as often as you are. And then what we want to do is try to get it resolved. That way you don't have to keep on having to have those headaches occur, and then also not have to rely on medication.
Yeah,
to
I hate
help that.
taking medicine, but sometimes I just have to.
I know, yeah, and it's not good for your liver. So, what we'll do is we'll take some X-rays. We definitely want to see the relationship between C1 and your occiput. See if anything is getting pressed and compressed there, causing those headaches. Now, Dr. Jed, he will talk to you a little bit more about that.
Okay.
But for now, especially since you're having headaches, I do want to go ahead and do a side view of your neck, if that's okay with you.
Yes.
Now, I also saw where you were having neck issues. So tell me about that.
So I've been having neck pain for maybe a year now.
Okay.
The headache started not too long ago, but I would say neck pain has been for a year. I think it just came out of nowhere. I don't know. I don't really know what could have caused it. It just happened.
Any injuries or surgeries in the past?
No.
Okay. And then where are you feeling your neck pain primarily? Is it or towards the back, any of the sides? Does anything bring it
I
on?
would say like right here at the top of my neck, like
Okay.
right here. I
Like
just
at
feel
the
like
base
it's
of your
really,
skull?
yes, it's really tight. I would say.
Okay. And is it persistent or does it come and go?
I would say it comes and goes.
Okay. Alrighty. Anything you're taking for that? Advil or?
No,
Okay. Got
I
it.
just deal with it.
Oh no, that's no fun. Alrighty, well, with that, the X-ray that we're gonna take on you, it's definitely gonna look at each segment within your cervical, so your neck. We're gonna be able to see head positioning, all of that, spacing. If Dr. Jed sees any sort of fusions, bone spurring, he will let you know. Now, any low back pain, extremity pain, any numbness and tingling into your arms?
Sometimes I get low back pain, but it's not a lot.
Okay. What seems to be worse with your low back pain? Bending over, standing, sitting for a long period of time?
Just sitting for a long period of time. Sometimes it just hurts right here in my lower back.
Okay, and do you mind standing up and showing me, please?
So it usually hurts about right here.
Okay, so that's lower, more so towards your
Yeah.
SI joint.
Yes, like right
Okay.
here. And for that, I don't really take anything or do anything.
Okay. And when did you say that started?
It just comes and goes.
Mhm.
Yeah, I wouldn't be able to say when.
Okay, do you think longer than a month, weeks, a year?
I would say for about a month now.
Okay.
A month.
Alright. Now, I do also see where you were seeing a chiropractor before. That's awesome for you to stay on top of your health like that. Now, were you seeing that chiropractor for any of these issues? Your neck, your headache, your low back?
I was seeing them for my neck.
Okay. And then what was your experience like? What were you getting? Just manual adjustments, or were you getting any sort of therapies, TENS unit use, or anything like that?
I was getting therapy. Yeah,
Okay.
kind of just massage. Well, I would get massages too, so just
Okay.
massages, therapy. But I just went for a little bit. My work didn't allow me to finish.
Okay. And when would you say your last adjustment was?
It was maybe 6 months ago.
So it has been a while. Maybe a lot has happened between now and then, so that's why these scans and x-rays are going to give us a better idea of what's going on with you, if we're able to help you, and then also if we are and going to be able to take you on as a patient, then how can we proceed with care with you, and how we're going to tailor adjustments to you, that way you're able to get your issues resolved.
Okay.
So since you did mention your low back pain, not only am I going to take an x-ray of your neck, but I will take an x-ray of your low back. It's just going to be an AP film, so it's going to be used in straight. We're going to want to see ideally straight spine and then level pelvis. Now if I go ahead and take that film, like I said, and I see any sort of either curvature in your back, or if I see sometimes what we see is like pelvic torque, then I do want to be able to see how that's affecting you, and we will proceed with motion x-rays. Now those motion x-rays, I'm going to have you bend to the right and to the left. Not only do we want to see how well you move overall, but what we're actually looking for is each individual segment to move. And so when you bend to the right, these segments right here, spinous processes should move over to the right, same thing to the left side. So if I see any of that, then we'll go ahead and take 2 more, but for right now we're just going to take one of your neck, one of your low back. Any questions so far?
No.
No? Okay. So what I'll do now is I like to go over what I call secondary symptoms. Not, for example, like headaches. We've already covered those. Not that your low back is causing your headaches, but sometimes what we do find is that things like your neck, that C1 relationship between your skull, but also things like allergies, GI, how is that function showing up inside of your nervous system. So I would say if in the last 30 days you've had more than 2 times occurrences, issues with these, then let me know, and then we can go ahead and add them to your file, okay? So we've already gone over headaches. What about any allergies, sinus?
I do get a lot of allergies, especially during the summer, the normal seasonal allergies.
Okay, well, are you taking anything for them? Sometimes people take them as needed, others do it beforehand as a daily kind of thing.
No, I'm not taking anything.
Okay.
I don't really like taking medicine.
Okay, you just kind of deal with them. And any issues with breathing, asthma?
No.
Okay, good. And then any issues with GI, with acid reflux, gastritis, anything like that?
No.
Okay. What about lower GI, so constipation, diarrhea, any of that?
I would say a little bit of constipation.
Okay. How long has that been appearing?
About a month, kind of when my back started hurting.
Okay. Anything you're taking for that to help relieve?
No, sometimes I just take some teas, but they don't really help, I think.
Okay. Got it. Well, what about your sleep? What's your sleep like?
So usually I get the headaches around nighttime, and they wake me up. They don't really let me go to sleep.
Okay.
So I just kind of wake up in the middle of the night, and then sometimes I have to take an Advil or like a little, Advil, but I don't really get good sleep.
Okay, well that can definitely affect your rest, your energy, your mood throughout the day. What I've seen in my experience with previous patients and cases is that if you're stuck in this kind of fight or flight mode, or you're in pain, or just your nervous system is stressed out, we have 3 different types of stress that can affect us. One is physical, so the pain that you're in, your body not moving how it's supposed to, not functioning. It's also chemical stress. So what are we ingesting? What are we putting inside of our bodies? Is it a bunch of medicine? Is it the food that we're eating? Is it the dairy, alcohol, things like that? And then we have emotional stress as well. So that can all pile up on us. Our body takes it as the same type of stress. And so whenever you get all these stress hormones pumped into you, then you're not allowed to heal properly. You're not allowed to function how you're supposed to. And then that definitely can bring things like immune system down. And then it can affect your sleep, your energy, things like that. So what we're going to try to do is see, one, if we can help you. If we can, I've seen cases in the past my experiences for other things, when we get you functioning and feeling better, other things start to clear up for you.
Okay. Mm-hmm.
And so that's what we want for you, just to give you every opportunity possible to be and feel your best.
Yeah,
Alrighty.
I don't want to keep getting these headaches.
I know they're not fun. So, what I'll do is I'll go ahead and bring you back. I'll get you started on these x-rays that I was mentioning. I will get them printed, so Dr. Judd will get a chance to look over them with you, alongside with you. You get to take them home. And so from there, he will do a spinal exam. So he's gonna have you lay on your back. And we want to see just the integrity of every single segment. So he'll start at the base of your skull, work his way down, then do the same thing with you flipped over on your stomach, and then he's going to check out your low back, your SI joints, try to pinpoint, is it more pelvis or is it more low back, or possibly both. From there, we do have EMG and the thermography that we told you about earlier. One is to look at your nerves, see how those are firing, and the other one is going to be looking at inflammation. And so if he decides to go ahead and get those done, then we will. And so I see that you're coming back tomorrow morning, 10 a.m. So whenever you do get back, that's going to be enough time for him to sit down with you, go over everything that we took on you, let you know, one, primarily, if we can help you, if you'd be a great candidate for chiropractic care. If so, he's going to tell you his best recommendation for care. From there, if you're on board, we can go ahead and get you started. And you know, that would be on that second visit. But for now, do you have any questions, concerns?
No, I'm good.
Alrighty, so if you'd like, I can go ahead and bring you back. I'll give you a quick tour, and then I'll get you started on your x-rays.
Sounds good.
Alrighty.